everyone, me and my teammates in this business model canvas are going to talk about the company BiVacor. Its headquarters is present in Huntington Beach, California, USA, and its clinical offices in Houston, Texas. So it was originally founded in Brisbane, Australia in 2008, later expanded to the US in 2013. It's a clinical stage medical device and a biotechnology company. Its mission is to develop a next generation artificial heart, total artificial heart, TAH, to address the global unmet need of patients with end-stage heart failure, especially those awaiting donor hearts, or for those heart transplants is not feasible.
Going to talk about key partnership and key activities, cardiac surgery centers and hospitals, academic research institutions, investors and grant agencies, suppliers of medical grade materials components, equipment manufacturers, clinical trial, CROs. Key activities, preclinical and clinical trials, regulator submissions and compliance, manufacturing and quality control, partnering with hospitals, cardiac centers, marketing, scientific outreach and publication.
Clinical trial infrastructure and partnerships, manufacturing capability, biocompatible materials, precious device, funding and capital clinical value proposition, a durable long-term artificial heart with fewer mechanical parts, lower failure risk, a compact device that can adapt dynamically to patient physiology, bridge to transplant and potential for long-term support, reduction in dependence, donor hearts, improved patients' mobility and quality of life compared to existing alternatives, cutting edges life-enriching technologies, leveraging rotating design.
Today I am going to talk about channels of BiVacor company. It includes partnerships with major hospitals or transplant centers, medical device distributors, regulatory or FDA pathways, scientific or medical conferences and publications, direct collaborations with cardiac surgeons or cardiologists. This company's customer relationship includes clinical support or maintenance services, post-implant monitoring and follow-up, collaborations in trials and publications. Customer segments of this BiVacor company: patients with end-stage biventricular heart failure who are not suitable for LVADs, hospitals or cardiac surgery centers, transplant programs, regulatory bodies, research institutions or clinical trial collaboratives are come under these segments.
Since BiVacor is a clinical stage company, its revenues are mostly from government funding, venture, equity investments, licensing, partnerships with larger medtech firms, and eventually sales, implantation, fees, service contracts, etc. Its cost structure goes like this: clinical trial costs, surgeries, patient monitoring follow-up, regulatory costs, manufacturing setup and quality assurance, personal cost, and marketing and training, hospital onboarding, post-market support, and servicing and maintenance.